Hi, my name's Alina, and my partners are Derek, Sony, and Vince, and for the past few months, we've had the pleasure of working with a brand new community partner called Choices, located in Rancho Cordova. Choices Day program was established in 1988 to serve and provide programs and services to adults with developmental disabilities. There are 5 different locations, and each of them include many specialized programs created for each of the clients to help promote independence, personal development, and provide them with knowledge about different topics. Each class is designed specifically for the needs of the clients based on what they need or what they want. Some topics include driver's ed, cleanliness, historic events, employment skills, and can sometimes even be exercise classes, which at times turn into dance parties with the joyous and fun souls of the clients. It never gets boring with them. The continuum of services for adults with intellectual and developmental disabilities includes the 7 main things as displayed on the right. One of these happens to include day programs, which is what Choices is. Day programs play a very main role in the development and growth of individuals with developmental disabilities. Developmental disabilities are health conditions that are caused due to impairment in physical learning, language, or behavior areas. These can be caused from genetic disorders and can occur in about 15% of individuals, according to the CDC. Some of these disabilities include autism, which occurs with social interactions and communications. Cerebral palsy is due to abnormal brain development and affects the muscles in an individual's body. A few other developmental disabilities include learning disorders, hearing loss, speech disorders, and vision impairment. The classes designed for the clients at Choices are hindered specifically for the developmental disorders and many others. As shown in the figure on the right, the continuum of disability has 4 main parts, which are all connected to each other. Poor sensory motor control can lead to decreased functional performance, which can then lead to musculoskeletal injury and increased orgasmic constraints. These continuum of disability highlight the main reasons why places like Choices are beneficial and necessary for adults with developmental disabilities.
Narrative humility is of the utmost importance to consider when treating individuals with developmental disorders. As we learned from Das Gupta in a TED Talk earlier this semester, narrative humility is being aware of our own prejudices, expectations, and frames of listening. What does this mean in the context of individuals with developmental disorders? It means that the first step to fixing a problem is acknowledging that there is a problem. It means that we have to be willing to ask ourselves the hard questions and confront our biases rather than shy away from them and hide them. We have to know that when we deal with individuals with developmental disorders, there will be challenges associated with their condition. In many cases, there will be communications when providing them with care. It could be mechanical problems, social problems, or conditions associated with the mind. It is difficult for us to acknowledge this bias in ourselves. We want to be perfect healthcare providers that don't mistreat others. But we have to understand that by refusing to acknowledge bias, we hold ourselves back from improving, and therefore we risk mistreating them. So what does narrative humility allow us to do? When we recognize that we will have to treat them differently, we open up ourselves to ask, how will I make their treatment different in a way that enhances their health care? For example, when we accept that we have to talk to them differently, we ask how we can formulate the way we talk so as to better communicate with them and to avoid offending them. What we learned from our experiences at Choices Day program was that often guardians have to prepare sheets for physicians to detail how to treat developmentally disabled individuals. Physicians often do not listen to patients because they think they are incapable of communicating their symptoms and concerns. Reading off a sheet and acting based on instructions is cold and passionless. Instead, why not embrace the fact that they have their own personalities and concerns? By creating organic conversations and dialogue, we can understand for ourselves their individual needs and be better able to serve them. We found that caretakers like those at Choices Day program often know more than doctors when it comes to individuals with developmental disorders. This is because they acknowledge that communicating and understanding the needs of individuals with developmental disorders goes beyond verbal communication and diagnoses. It necessitates a fundamental understanding of the person right in front of you. At the same time, it is important to acknowledge that the relationship you have with that person may hinder your perspective of their health. For example, we might attribute a certain symptom to their disability when it might actually be a symptom of a more drastic healthcare concern. And now Vince will talk to you about how when we ignore narrative humility, things can go wrong.
While narrative humility is an important topic within the field of medicine, it is one which healthcare professionals sometimes struggle with applying to patient care. During our time at Choices, the team told us about various times in which they saw mistreatment by doctors and healthcare professionals when treating their clients. One of the major concerns they cited was that the doctor would often dart immediately to conversing with the parents of the patients rather than the patient themselves. Clients at Choices said this often led to them feeling isolated from everyone else and feeling as though they had no voice. Doctors can be rushed at times while aiming to provide the best care possible, but when the assumption is made that a patient who is an adult with a developmental disability can't communicate for themselves, it causes isolation and distrust amongst the community toward doctors and healthcare professionals. Just because an adult has some type of developmental disability does not mean that they are not smart enough to talk for themselves or describe what they are feeling or what they want. Clients at Choices had a wide range of disabilities, and the vast majority of them were able to clearly communicate with us. By assuming that they cannot talk for themselves, doctors take away their voice and accidentally make the community feel as though they are less than.
These first-hand experiences were vital for us to learn the importance of narrative humility. The first thing we did for Choices Day program was learn about the history of individuals with developmental disorders. In many ways, this is one of the most important things to learn about. Part of narrative humility is understanding how individuals with developmental disorders have been affected in the past and how what we do is important to adding to that story. The Lanternman Act was an important milestone that changed treatment of individuals with developmental disorders from being people that were hidden from society and left to rot in psychiatric institutions to today becoming important members of society. When we reflect on the past inhumane treatment of individuals with developmental disorders, it is impossible to not be filled with disgust at our past. But this only adds to the pride that healthcare professionals feel when they put their passion into treating individuals with developmental disorders today. In fact, treating individuals with developmental disorders is an area that has seen continual development, as we have only recently begun to offer services such as those given by Choices Day program in the last few decades. They are truly pioneers in their field, and the work that they do has the potential for defining incredibly important guidelines on the important ways to treat individuals with developmental disorders. So how does what we learned about narrative humility relate to a bigger picture of us as healthcare professionals and society in general? We learned that we need to embrace our biases to fix them. We learned that we cannot make assumptions about individuals with developmental disorders to avoid mistreating them. We also learned that we need to talk to them and build a dialogue that makes them feel comfortable with us. What is so special about individuals with developmental disorders? How are we treating them any differently? The point of learning from narrative humility is that we do not need to treat them differently. When we accept our biases and acknowledge that they have their own unique needs like everyone else, we truly see them with the utmost respect as a patient and can treat them as if they are as important as any other patient. And in the end, it is our responsibility to extend the same treatment to all our patients and every life we end up touching, as these skills are essentially just basic interpersonal skills and what makes us human. And now Sonia will talk about the community perspective.
Some challenges that this community faces are being treated like children or incapable of doing things on their own, and being treated differently than others and hurtfully. Adults with disabilities have often struggled with bullying, mistreatment, social isolation, and feeling alone. This is unfair. These individuals can speak for themselves and are strong, have vibrant personalities, and are all around really fun to get to know and be friends with. It's important to hear what they're saying and make sure that they know that they are heard. Adults with disabilities want to be treated like everyone else, fairly and respectfully. Take time to get to know them. We are all more alike than we are different. This perspective was taken from talking to several community members and supervisors at the program, as well as looking into documented interviews with members of the community online. The goal of the organization is to help this community adapt and better integrate into society and become more independent.
Overall, our time working with the Choices program was fantastic and gave us a whole new perspective on how to work with the adults with developmental disabilities community. Right off the bat, one of the first things we saw was just how warm and friendly the community was to us. Every day when we went to volunteer, it was like a treat as the people there were so sweet to us despite not knowing us all that well. They really like to make friends and really care about the people they interact with. And so it's really important that we were there not just to check off a box in order to make a strong connection with them. To gain the trust of this community, you need to show them that you truly care about them and that they matter. While they may have a developmental disability, this does not change the fact that they are adults and can do most of the things adults without developmental disabilities can do.
By treating them with respect and listening to their stories, they will realize you care and open up to you. This experience was important for us as future healthcare professionals because this is a community we will at one point or another work with. And this is also a community that a lot of healthcare professionals don't necessarily deal with in the best way. This experience has helped us grasp a better way to work with this community going forward into our careers. and realize what needs to be done to bridge the very valid distress that this community currently holds towards the healthcare field.
We would like to thank everyone who helped us on this presentation, especially Ariane, Dr. Braxton, and Moira.